Welcome back to our ICD 10 PCS 2025 series. In this video, we're covering Section 2, Placement, which includes procedures where something is put into or onto the body, like catheters, feeding tubes, or splints. This section doesn't involve cutting or removing tissue, just placing something to help with care or recovery. Let's break it down.
1. What is Section 2 placement? Section 2 of ICD 10 PCS includes procedures that insert or apply a device or material without doing surgery on the body itself. These are common in intensive care units, ERs, inpatient rooms, surgery recovery areas. Some common examples are inserting a urinary catheter, placing nasal packing, applying a cast or splint, putting in a feeding tube or central line. These are supportive procedures, not surgeries.
2. Code structure, explained simply. Let's look at how a typical placement code is built, using this example. Code 2W3DX4Z. This code means a central venous catheter was placed into the right subclavian vein using a needle, percutaneous approach. Let's explain each character. First character, 2, section. This is the placement section, which covers inserting or applying devices. Second character, W, body system. This means we're working on a vein or artery, part of the body's circulation system. Third character, 3, root operation. The procedure is insertion, meaning something was put inside the body. Fourth character, D, body part. The device was placed in the right subclavian vein, which is near the collarbone. Fifth character, X, approach. The doctor went through the skin using a needle or small incision. This is called a percutaneous approach. Sixth character, 4, device. The device placed was a central venous catheter, a tube used to deliver medicine or fluids directly into a large vein. Seventh character, Z, qualifier. There's no extra information, so it's coded as Z for none. So again, in plain terms, this code means a central line was inserted into the right subclavian vein using a needle.
3. Common root operations. Now let's go over the 6 main root operations used in Section 2 and what they mean in real life. Insertion. Putting a device inside the body, e.g., catheter feeding tube. Immobilization. Applying a device to keep a body part from moving, e.g., splint, cast. Packing. Inserting material to absorb fluids, e.g., nasal packing. Dressing. Applying a covering to protect a wound, e.g., sterile dressing. Traction. Using pulling force to align bones, e.g., skeletal traction in a broken leg. Application. Placing something on the outside of the body to support or protect, e.g., pressure bandage, neck brace. Think of this section as placing tools in or on the body. Nothing is being removed or cut.
4. Real coding examples. Let's go through a few real-world examples in plain language. Example 1. Urinary catheter insertion. Code 2H60X1Z. Meaning, a Foley catheter was placed into the bladder through the skin, like at the bedside. Example 2. Nasal packing for nosebleed. Code 2K21X5Z. Meaning, absorbent material, like gauze, was placed into the nose to stop bleeding. Example 3. Right wrist splint. Code 2NJ3X3Z. Meaning, a splint was applied to the right wrist to prevent movement, like after a sprain. Example 4. Insertion of feeding tube into stomach. Code 2W1G X6Z, meaning A feeding tube was placed into the stomach through the skin.
5. Quick tips. Here are some simple tips to help you code placement procedures correctly. Always ask, what was placed? Where? How? Use insertion for internal devices and application for external ones. Double-check right or left side, if mentioned. If the skin was pierced, it's percutaneous.
And that wraps up Section 2, Placement in ICD-10, PCS 2025. This section is key for coding supportive procedures like catheter insertions, splints, wound dressings, and more. Just remember, this section is all about putting something in or on, not cutting anything out. Next up, Section 3 Administration, where we'll look at coding injections, infusions, and transfusions. If you found this helpful, like the video, subscribe for more, and drop your coding questions below. Thanks for watching, and happy coding!